PCD is a difficult disease to diagnose, partly because of the lack of awareness. If you're not looking for it, you're not going to find it. People go decades without a diagnosis. Primary Ciliary Dyskinesia is a genetic disorder that affects the lungs primarily, but the cilia lining the upper and lower respiratory tract, along with other tracts in the body. Basically, the cilia don't function properly, so there'll be a buildup of mucus and bacteria, and in most people, that's cleared automatically. For PCD patients, we have to do it manually. So we actually have to bring the mucus up. And even in doing so, that buildup of mucus will be a breeding ground for bacteria and infection. As time goes on, eventually you're going to get sick. With that would come oral antibiotics, which were very effective early on. That's no longer the case. There's a resistance built up to them over time after taking them for 2 decades plus. Upper and lower respiratory congestion, increased cough. I bring up mucus on demand at any point, 365. That's just baseline.
Breathing.
So I'm always coughing. So when I don't feel well, it's always compared to baseline. So I'm coughing more than I typically do. I'm more congested than I usually am. I'm wheezing more than I typically would. There's not a one-size-fits-all approach. It's a broad spectrum disease. It affects people very differently. I've seen the dark side of PCD from a non-compliance standpoint. I'm not taking care of myself, and I got sick. And I got sick repeatedly. I've also seen the side where you are compliant, you are doing the right things, and I still got sick. And back in 2015, I got very sick, where I went into septic shock. And that led me to the ICU for, I believe, 3 days. And then in the regular hospital floor, pulmonary floor, for another 5 days. You just never know. It could be, okay one day, not okay the next. So using that frame of it, it's, what am I doing today to give myself the best chance at tomorrow? But given that there are no approved therapies, I think that physicians are hesitant to prescribe different things. The number of medications that are available to patients is very limited. So if you looked at my medicine cabinet, I take 3 drugs. Whereas as the research continues, as there are opportunities to participate in trials that are more targeted to PCD, that will likely grow. I got involved with the PCD Foundation in my early 20s. It was a time where kind of coming out of the darkness and reevaluating how I'm caring for myself and what I'm doing to either get or stay healthy. And part of that process was, well, what's going on with research? And I would be part of a call here or there with the leadership at ReCode, knew that they were inching closer to a clinical study in PCD. Fast forward to today and it's underway. And if you look back 3 years ago, 5 years ago, 10 years ago, some of the stuff would not be believable that it would happen this soon. Because of the work that ReCode is doing today, there's more hope for PCD, PCD research, PCD patients than ever before.